everyone. Welcome to Season 2 of Hala City from Mediclinic City Hospital. Today we have two distinguished guests with us, our esteemed urologists, who are not only experts in their field, but also champions of men's health. Thank you for being here. We're honored to have you here both with us today to shed light on some important men's health issues, particularly as we are in Movember, which is Men's Health Awareness Month. Please introduce yourself.
Thank you so much, Dr. Anfal, for inviting us here. So my name is 𝗖𝗶𝘁𝗆𝗶𝗰 𝗔𝗍. I'm a consultant urologist and laparoscopic surgeon. I work at Mediclinic City Hospital.
Thank you. Doctor?
Hi, I'm Mahesh Dhanjee. I'm a consultant urologist and robotic surgeon based at Mediclinic City Hospital.
Thank you. So we'll start with you, Dr. Ali. Would you mind sharing a personal story regarding men's health awareness?
Yes, thank you so much for asking. That might come as a surprise to yourself. So actually, I do have a personal story with this. At the age of 27, married with a 2-year-old kid, and just about to start my urology training. While having a shower, I found I have a lesion in my private area. So a day later, I went to the urologist, and then ultrasound confirmed that I have a tumor, which was removed, and I was found to have testicular cancer. So after the surgery, I had radiotherapy, and I'm cured. And thankfully, because I was well informed being a urologist in training, that's why I would advise basically my fellow men to come forward if they have any problem and go and visit the urologist.
Wow, amazing story. Thank you for sharing such a personal experience. And actually, as a urologist, I can imagine how difficult that must have been and all the diagnoses coming into your head.
It was indeed. I mean, I was filled with mixed feelings. So anxiety, fear, anger, believe it or not, and then acceptance and the determination to heal and be better for my loved ones. So that's why I'm really encouraging all men to come forward if they feel or they sense anything abnormal, even if they don't, as part of a general screening.
Absolutely. And that definitely contributes to your passion as being a urologist.
It does indeed.
Thank you. Thank you so much. Dr. Mahesh, what are some of the common misconceptions that you could share with us with regards to men's health?
Yes, there are quite a few, but I'll just mention 2 or 3. The one is that as men get older, their bladders get weaker. That's why they can't pass urine properly. There's a misconception that men have to just live with this. But we know that bladder and prostate problems, which can occur independently or together in patients, can be treated both medically and surgically, and patients don't have to live with it, so that we can improve their quality of lives. The other misconception is that if the patients have no urinary symptoms, that they probably don't have prostate cancer. And nothing could be further from the truth, because prostate cancer, especially in its early stages when it can be cured, usually has no symptoms. And also importantly, we see lots of patients in our clinic with erectile dysfunction. Many people think that this is just a sexual disorder. However, it is part of a larger cardiovascular problem, and we know that patients who present with erectile dysfunction could, within 3 years, present with myocardial infarctions or heart attacks, as they are commonly known, because the blood supply to the penis is also obstructed in the same way that the blood supply to the heart is obstructed.
That's a very important piece of information. Dr. Ali, what's your take on the Movember's global impact and evolution in the community?
So before the start of actually Movember charity, which was started in Australia in 2003, men's health, physical and mental health, was generally unheard of, because men tend to bottle things up and they don't come forward to share their problems with the professionals. But actually, since 2003, more and more numbers of men are coming forward to present their symptoms, and that has led to earlier diagnosis, happier life, and of course cure. So that's the important message that I want to deliver, is that men have to come forward if they have any problems.
Dr. Mahesh, what do you think of the role of social media in this time and age with regards to the Movember awareness?
Yeah, I think social media is extremely important. If we think back that Movember started in 2003 by 2 Australian friends who just wanted to make moustaches trendy, trend took off in such a big way. They thought, let's put it to good use. And from the subsequent year, they tried to raise awareness and funding for the Australian Prostate Cancer Association. At the time, social media was not as prolific as it is now, and with the use of Facebook, Instagram, Twitter, etc., more and more people are coming to the fore, creating awareness. They're also sharing personal stories, which men never did a decade or 2 ago, and this obviously allows men to become more informed and hopefully live healthier, happier, and longer lives.
So, Dr. Ali, I'd like to touch upon another important subject with regards to men's health. What are the challenges that you've noticed with regards to Movember's focus on men's mental health?
Thank you very much. So men's mental health is an integral part of men's health. And the problem with the mental health here, or the mental illnesses, if you like, they are normally stigmatized, unfortunately, in many parts of the world, especially in our part of the world. And men themselves, they don't tend to come forward. They just bottle things up, bottle their problems up. So anxiety, depression, all these things. And of course, mental health is an integral part of our general. And if that gets deformed, then it will significantly impact on our physical health. So the Movember basically shown the light towards mental health, and I strongly encourage men who don't feel right, feel depressed, feel anxious, they need to come forward and seek help.
Thank you for getting the message out there. Dr. Mahesh, what are some inspiring moments that you could share with us from your previous Movember experiences?
Just to follow on what Dr. Ali said, I remember quite clearly there was a father and son. The father was diagnosed with a bipolar disorder, and because of this, the son was very anxious in public, at family gatherings, etc. So much so that he developed an anxiety disorder. And after the Movember campaigns became the norm, the son got the courage to come and get treatment for himself, and eventually his father as well. And in the end, they both have happier and healthier lives. The other story that I have is of a 17-year-old who presented to me after a Movember campaign with a scrotum the size of a grapefruit, and he'd been harboring a testicular tumor for about 6 months. But because of the Movember campaign, he had the courage to come out, have this examined, he was treated, cured, and he subsequently got married, had children. So yeah, there are definitely good success stories out there.
Amazing. Amazing. So these are the life-changing positive impacts that we'd like to see from this campaign.
Absolutely.
Thank you so much for being here. Thank you for sharing your experiences, and Dr. Ali, of course, your personal experience. I hope this would trigger our viewers to also get the courage to go and seek their urologist and get tested in this month. Stay tuned for another episode of Hala City from Mediclinic City Hospital. Thank you.